So the advantage to this procedure is that, for example, a lot of people will, particularly in horses, if we have arthritis or if we have conditions that are causing inflammation within a joint, the old standby has been to inject steroids with a little bit of an antibiotic, and the objective is to take away inflammation and swelling and pain. The challenge with doing that with steroids is that, one, you're going to destroy cartilage because ultimately the medication that you're putting in there is going to destroy cartilage and it's going to thin out joint fluid. So ultimately what ends up happening is you do a joint injection, you get great results from it, but then you have to keep doing it because now you've destroyed cartilage, you've taken the joint fluid down, and so now you're going to have to redo this procedure every time this animal starts to have problems. And ultimately you make the damage worse because when you do a steroid injection and the animal doesn't feel any pain right off the bat, they've destroyed cartilage, you've altered joint fluid, but now you're in a position where that animal is going to use that joint more. And if they use that joint more, they're going to tear that joint up more. So sometimes pain is actually not a bad thing. With this procedure here, we don't really alter anything in terms of the anatomy other than we're just trying to use the body's own ability with platelets to heal what's possibly damaged. So the objective is to possibly try to restore cartilage, to maybe try to heal joints or tendons or ligaments. And if indeed we get to that point to where we've tried this therapy and it has not worked, it hasn't closed the door on any other therapies whatsoever. If we have to go to surgery and do something different, we can still do it. We haven't changed the anatomy, we haven't really altered anything about this joint. We've attempted to utilize the body's own healing processes to do what it needs to do, and if it's unable to do that, we still have other therapies and other modalities that we can try. To date, we have typically used this on dogs for torn ACLs, CCLs in dogs, meniscal injuries, arthritis in the hips, and today we've had to do no follow-up with those animals. Every animal that we have done has done very, very well. Clients are asked on a scale of 1 to 10 at 4, 8, 12, and 16 weeks post-injections what their thoughts are. 1 being a dog that came in just the way that it was to us when it was lame, and a 10 being perfectly normal and couldn't notice a difference. Most of our clients that we have gotten information back from, on average 6 to 8 weeks post-procedure, we're sitting in an 8 out of 10. The dogs that we've done up to a year ago when we first started this procedure, we have not done again. They've been fine, they're walking well, the owners are happy, the dogs seem to be pain-free, so we haven't done it again.